Have you recently got testing results back or noticed an uptick in your thyroid symptoms and wondering what's to give and what continues to drag your thyroid flares? In today's video, I'm going to walk you through the root causes of what drives thyroid flares, what causes your antibodies to jump, and what also causes changes within your T4 and T3 levels. Today's video is going to help you understand what's driving the imbalances in your thyroid and these changes that you might be seeing in your labs and your symptoms, and where you can start to address things. So let's get into it. First and foremost, we want to ask the question is there autoimmunity present? So if you have Hashimoto's or Graves' disease, which is the autoimmune version of hypothyroidism and hyperthyroidism, then what's driving your flares might look different than someone that doesn't. So it's always very important that with any thyroid symptoms or thyroid diagnosis, that we have a clear understanding on if there's autoimmunity at play. In majority of cases, there is, but not always. And if there is autoimmunity at play, then we want to always start with the immune system whenever we're noticing flares happen within the thyroid, because that's actually where the origination of the thyroid changes are happening. Essentially, what's occurring is the immune system is overdrive and is attacking the thyroid. And that's actually the causative factor to what is then impacting the production of your thyroid hormone levels. So the immune system is the first place that we want to address. And we want to look at what could be the variables that are altering the immune function. Some examples can include any shifts within the immune system activation process. So if you've recently had any type of flu or cold or any type of virus, that can sometimes pose a risk to the autoimmune process going into a bit of overdrive. If you are noticing any changes within your gut, maybe you've recently had something like food poisoning, or you suspect you might have a parasite or some type of pathogen, any type of gut dysbiosis where there's this imbalance of pathogenic bacteria and potentially not enough good bacteria to support our gut immune system, can pose some of the changes that can happen within the immune system. And they do this, they're actually driving a process called increased intestinal permeability or leaky gut. And leaky gut is known to be one of the causative factors of what drives the autoimmune process to actually begin in the first place. So if we're seeing more leaky gut type scenario happen, then this is definitely an area to investigate in terms of what's causing the gut to be leaky. Other than some pathogens and dysbiosis in the gut, there's other variables such as things like glyphosate and gluten exposure. So if there's recently been dietary changes, maybe you've been eating a lot of wheat and gluten-containing foods, this could be one causative factor. If you've been under a significant period of stress, stress can also weaken our gut barrier, and this can also pose a risk factor, especially as well if you're doing a lot of high-intensity exercise, especially when it's in the high intensities and when it's in the heat, can actually make our gut more permeable or leaky, especially in that acute time period after exercise. So we especially want to be really cautious with what you're eating right after exercise. If you're doing the common marathoner type diet where you are going and running 20 miles plus, 20 plus miles, 24, right? And then you are then drinking a bunch of beer and having pretzels, then you can imagine the type of leaky gut environment that this might be triggering. So those are just some things to think about when it comes to the gut. Other variables that could impact the immune system include vaccination. If you've had any type of vaccination, that can cause an immune trigger. Or if you have recently gone through any type of big hormonal transition, if you have either recently gone through pregnancy and now are in the postpartum time period, or you have recently gone through menopause, these hormonal transitions can also impact our immune function because hormones like estrogen and progesterone are actually incredibly important for immune regulation. So when there's a big change that happens pretty abruptly, that can also cause some of these shifts to happen within our immune function. It can also, without the immune system, pose some changes to the thyroid. For example, estrogen actually increases thyroid binding protein. So we see that when women are in a more high estrogen state, such as what can occur when you are in perimenopause, where there's more of this estrogen dominant type pattern, or in women that have conditions that are estrogen dominant like endometriosis, we see an increase in thyroid binding proteins, which can actually impact the free levels of those thyroid hormones independent of the immune system. So any big hormonal shift can play a role, and it doesn't necessarily always have to be your endogenous hormones. This can also be exogenous exogenous. So if you've recently started or changed birth controls, or if you started on any type of hormone replacement therapy like testosterone replacement or progesterone replacement, that can sometimes also be an area for us to investigate further. So hormones are always a big driver. And then I mentioned stress as part of the leaky gut picture, but stress in general can also impact overall thyroid function. What happens when our body is under chronic stress is that our body actually deactivates the amount of T4 that's converted over to that free active form T3. And we see more of that T4 getting deactivated over to reverse T3. Unfortunately, reverse T3 does nothing for our cells. It doesn't actually support any of the growth and speed processes that T3 does. So when there's that deactivation happening, you're going to notice more symptoms like brain fog, fatigue, slow digestion, maybe metabolism issues, blood sugar abnormalities, all occurring because we don't have as much of that T3 there available for the cells. I also mentioned that your gut can become permeated during exercise. Exercise in general can also pose an issue to the thyroid if we're overdoing it. And it all comes back to redox balance. This is essentially the balance of the amount of oxidative stress that's happening in our antioxidant reserves. So if we are doing a lot of oxidative stress inducing exercise, such as like high intensity exercise, especially if it's long duration high intensity, or we are not giving ourselves adequate recovery in between training sessions, especially things that are more challenging that cause more inflammation, such as strength training or high intensity interval training, there can be this imbalance in redox to where we don't have enough antioxidants endogenously and through our diet to be able to help our body control that amount of oxidative stress. So we always want to make sure that we are in a net positive, that we're ingesting and eating more antioxidants than we are creating oxidative stress. And if you have made a big change to your workouts and you feel like you're not recovering very quickly, you feel inflamed, or you don't feel like the workouts you're doing are creating the adaptation you're after, so maybe you're not really getting stronger, you're not really getting faster, those can be some indicators that maybe you are doing too much or that there's not enough recovery space in between. And everyone's amount of recovery that they need looks different. So if someone else is doing the exact same workout plan as you, they might do just okay, because you have to remember that our body doesn't know the difference between stressors. Everything is looked at as a stressor in general. So if you maybe have a higher stress load in other areas, such as personal life or work, and then the person next to you does it, then even though you're doing the exact same type of workouts, they might be causing more oxidative stress and inflammation for you simply because of what your baseline stress looks like. So we always want to think about the context of where we're doing these types of workouts, but redox balance is another key piece here. Outside of that, we can look at other variables within that stress bucket. So I mentioned earlier the biochemical stressors, like what could be happening in the gut and such, but also even simple things like, are you not sleeping enough? Are you under sleep deprivation? We know that just as little as 6 hours of sleep per night can actually decrease that T4 to T3 conversion. So if you've been under a period of not sleeping well, this can absolutely be another contributing factor. And even if you're getting enough total sleep, but that sleep is very fragmented, that can also drive this. And that's something that I see a lot in I saw myself postpartum. I've seen a lot of postpartum patients because maybe you are actually getting a full 8+ hours of sleep, but you're waking up a lot in the middle of the night. And that is a big stressor on the system because you're not actually getting good quality deep sleep. And deep sleep is where our body really creates those hormones and helps our body with that recovery process. So those are some areas to investigate further that could be causing both a shift in the amount of T4 and T3, so those active and inactive thyroid hormone levels, as well as an uptick in your thyroid antibodies. Keep in mind that some fluctuation is expected and normal. So a little bit of a change in antibodies is not to be concerned about. A bit of a change in thyroid hormone levels is not to be concerned about. We're really looking at big shifts and then symptoms alongside those changes. And that's a really important distinguishing factor with the thyroid, is that lab testing is not always the most accurate representation of what's actually happening within the thyroid. I have a video on this where I talk about the history of thyroid testing and why that is. But we really want to make sure that we're pairing your levels with your symptoms. And if you're noticing a change in things like sleep and mood and brain fog and your heart rate variability or your resting heart rate and your digestion, these can be indicators that there may actually be some deeper things going on that are causing more of this deactivation of your thyroid hormones. And this hyperresponsive state then makes the immune system go into overdrive. And that's when the immune system then accidentally attacks tissue that it shouldn't. And that's when autoimmune process occurs. So, what can we do to prevent this if you maybe have someone that you know has dealt with this and you are not wanting to also deal with this? First and foremost, we can get to the root cause of our gut. Keep in mind, you don't always have gut issues, even though there is leaky gut and dysbiosis in the gut. So, it's always a good idea to get to the root of what's happening in the gut and strengthen your gut health as much as possible. The second thing is support your mitochondrial function, train smart, recover smarter, make sure that you have enough antioxidants in your system and that you're eating enough to be able to support the recovery processes, and be smart about what that looks like around training to make sure that you're not overdoing that load on the digestive system. Now, if you're someone that already has an autoimmune disease that's developed, there is still hope. If you haven't already done some testing to understand the root causes of your autoimmunity, that would be a great place to first start. I would recommend investigating further what's going on within your gut, as well as your immune system, looking at things like your white blood cells and lymphocyte production, as well as understanding, do you have enough of these key nutrients for the immune system and mitochondrial function? Is there mitochondrial deficiency happening? And are there any viral infections that have been reactivated, or maybe even just an overall high viral load? Because even just the process of having a lot of viruses that you've had in the past that are in very high quantities can pose an incredible amount of inflammation and burden on the immune system. And that in itself can cause some of the mitochondrial depletions that we talked about in today's video. I hope you found this video helpful and that it helps make a little bit more sense as to how you could be so healthy and experiencing autoimmune processes or other types of chronic health challenges. Please know that you are not alone, that there are so many people out there that have similar stories to you, and it's something that we work in our practice with one-on-one all the time. If you want to learn a little bit more about the immune system and mitochondrial function, I have several other videos on my channel that explain a bit more about both of these processes that'll help you be able to understand what could be happening here. Thank you so much for tuning in today's video, and if you want to see more videos like this, be sure to hit the bell to subscribe to my channel so you'll be the first to know when I release a new video.